WYPL TV 18 presents Health Matters with Dr. Mark Costello, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.
Welcome to this edition of Health Matters. I'm Dr. Mark Costello. This is February, and February's Heart Month. So today what we're going to do is talk about your cardiovascular health. We're going to have some specialists on today that we're going to talk to. We're going to have some fascinating patients that actually underwent some of these procedures that the heart doctors are going to be talking about, so that you can learn from a patient's perspective about coronary heart disease. So it's going to be an exciting show, it's going to be a fun show, but hopefully you're going to be educated and enlightened about heart disease, because heart disease is the #1 killer in the United States. But first, here on Health Matters, we're always concerned about your health, and we're also concerned about especially men's health. And I would like for the men to remember to get one of these and to get one of these for your good health come February 14th. So, joining us now is Dr. Steve Gubin. He's the president of Stern Cardiovascular Center, and he is one of our experts that we're going to have on our program today. Welcome, Dr. Gubin.
Thanks for having me.
Now, your office is right next door to mine, and so oftentimes I come over there and borrow a cup of penicillin from y'all, but your establishment has been there how long?
We've been in existence for over 94 years.
And you're like the 4th president of Stern Cardiovascular?
I'm the 4th president.
Great. Well, today what we want to talk about and try to educate our audience about are the signs and symptoms of coronary heart disease. First off, what is heart disease? What is coronary heart disease?
Well, coronary heart disease is a disease when you develop some plaque or build up of plaque in the arteries that supply blood to your heart. And
then when this develops over time, what type of signs or symptoms do patients develop when they have those symptoms?
Well, for signs of a heart attack, the most common symptom in both men and women is chest pain. It's not always what you see in movies with like an elephant sitting on your chest. It can be chest pressure, a fullness, a tightness, and often this chest pain radiates to the neck, jaw, back, or shoulder. You can also have some associated shortness of breath, or you can break out in a cold sweat. These can be signs or symptoms of a heart attack, and you should notify your doctor immediately.
Now, I understand that women oftentimes have different symptoms than men do when it comes to coronary disease. What are some of the typical symptoms with women?
Well, you know, the most common symptom in both men and women is some type of chest discomfort, but women are more likely to have atypical symptoms. They may have indigestion, fatigue, shortness of breath, a decrease in exercise tolerance, and these may be signs of a problem.
Now, some of the literature that I've read says that heart disease is the #1 killer in the United States, and possibly 1 in 4 people have coronary disease. What about locally here in the Mid-South? What's the incidence of heart disease here?
Well, nationwide, heart disease is the #1 cause of death, not only in men, but also women. So it's not just a man's disease, but it's actually much more prevalent here in the Mid-South. You know, I call this the barbecue belt. And we have a high risk of obesity, hypertension, diabetes. These are all risk factors that can lead to heart disease.
So you're saying don't eat barbecue, right?
I'm not saying that.
Oh, okay. You better not here in Memphis. Okay. Now, when someone has these type of symptoms that you mentioned, chest pain and shortness of breath and possibly left arm pain, what should someone do if they're at home and experiencing these symptoms? What should they do?
I'd probably say take an aspirin right away. And then I would recommend that they go to the emergency room, call 911. They shouldn't ignore it.
Well, that's such a good point, because there's a lot of patients that just try to ignore it, especially men. Men seem to be the most stubborn about going to the emergency room. So if you're having any of those symptoms, it's important to get care quickly. Now, once you get to the emergency room and your care starts, what happens then?
When you first get to the emergency room, they'll first do an EKG, take a good history, get blood work to see if there's any evidence of any damage to your heart. If there is some EKG changes that suggest that you may be having a heart attack, you may be you'll probably be taken to the heart. You may be taken to the cath lab. But in between, you'll be given like an aspirin, a blood thinner such as heparin, beta blocker, oxygen.
What's some of the ways that we diagnose heart disease? You mentioned heart cath. Are there any other ways to do that?
When you first get to the emergency room, the first thing we do probably is an EKG. Do blood work. We check what we call a troponin, that if it's positive, it tells you that you may have had some myocardial damage. And then you can also do non-invasive tests, a stress test, a nuclear stress test, even what we call a stress echocardiogram. And the gold standard is to do a heart catheter, what we call heart catheterization.
And a heart catheterization is
a test. It's a gold standard. Actually, it's a test where you insert a little tube, usually in the artery in your groin, and then you inject some dye into the coronaries to see if there's any blockage.
Now, at that point, you can actually fix some of the blockages with something called a stent, correct?
Right. You can usually, if there's blockage there, they usually initially use a balloon to open up the blockage, and then they can place a stent that keeps the artery open.
And again, I just want to emphasize more and more how important it is on early intervention.
Yeah, time is muscle. I mean, it's very, very important not to ignore this, because if you don't open the artery in a timely fashion, that muscle dies, and then it doesn't come back.
All right, well, thank you, Dr. Gubin. We're going to be right back with some other information about coronary heart disease. Thank you for joining us on Health Matters. I'm Dr. Mark Costello. Our show today is about the heart. We're having different heart specialists come talk to us about procedures and signs and symptoms that we need to know about. But more importantly, we're going to have some patients here that actually experienced heart disease. Our first guest today is Mr. Jim Sykes. Mr. Jim Sykes is a disc jockey for Elvis Radio on Sirius XM.
That's right.
Welcome, Jim.
Thank you. Appreciate you asking me.
And Jim is also, he shares a Friday afternoon program with a Memphis icon, George Klein, who has a program on this TV station called Memphis Sounds. Be sure and check that out. Well, Jim, tell me about the day that you walked into my office.
Well, I've been suffering from some symptoms. I didn't know what was going on really for about a week and a half. And I told George at the radio station, I said, George, I'm just not feeling well. He said, go see my doctor. He's got an Elvis waiting room. So I did. I came to see him.
Now, not everybody knows that, but at our office we have an Elvis room, a special Elvis room. He was our patient there and everything, but that's what he's talking about.
And it was a quick visit with the nurses. They said, what's wrong? I told them I didn't feel good. I had some pain in my arm. I had some night sweats. I started vomiting, and I was really having some pressure in my chest. And they immediately put on I guess it's the EKG. Is that what that is? And within moments, you came into the room and said, Jim, lay back, put this pill under your tongue, you're having a heart attack. And that was the first time I'd met you. And you called the ambulance. They took me into the hospital, and that morning they did triple bypass surgery and saved my life.
Wow, wow, what an incredible story. Not oftentimes does a patient come in the process of having an acute MI, but Jim was, and Jim was so fortunate that things turned out like they did. But tell us a little bit more about the symptoms that you were having prior to this, Jim.
Well, I had actually forgotten some of the symptoms, so I asked my wife. She was very, very angry at me because I wouldn't go see the doctor. And I remember her screaming at me, you've got to go see the doctor. And so I finally did.
Men do what your wife tells you to do. That's so important. All right, go ahead.
But when I finally did go see the doctor, it was almost one of those textbook cases that I've continued to read about over the last 18 months since the surgery. It's one of those things where I just didn't know what was going on, and if I'd have gotten to the doctor earlier, I might have actually not had to have gone through the surgery. And so I want to make sure to advise everybody, please go see your doctor, go to the emergency room at the first sign, and those signs are so easy for folks to remember. It's chest pain, problems with maybe your arm, or like I was suffering, I threw up several times, and there were just a number of signs that I should have known.
At one point you were thinking you were just having some shoulder pain.
I thought it was my old trapezius muscle injury from being a kid, you know, and it was circulating down my arm, and then you hear these phrases now, and I think, well, I should have known. And it's just that masculine thing. You don't want to go see the doctor, but please go see the doctor, and don't go through what I went through. It's not an easy thing to get through the triple bypass surgery. There were weeks there where I just didn't know if I'd ever be the same. But now I'm much better. Stop smoking. That's the most important thing.
Most important.
I was smoking 3 packs a day, and I don't smoke at all anymore. It's been 18 months. My lungs, I feel so much younger and so much more vibrant. I have so much more energy. You also have to eat right. You taught me how to eat right. I came back to you weeks after the surgery, and you began to tell me what I needed to do, and then you told me I had diabetes, which made a radical change in what I eat. I had to drop all the sugars and all the colas. But really the most important thing, I think, is the exercise. You've got to get exercise, and for 49 years I didn't exercise at all. I didn't get up out of my chair. I just talked on the radio, so I sat there behind the microphone. But now I'm exercising, and I really feel great afterwards. That's the thing, is once you start that exercise program, you're going to feel better, and that's the whole point.
Well, Jim is a poster child for what you should do after having the bypass. He has done so well and has been so compliant. But take us back to you getting the heart cath, and then you're being told that you have to have a bypass. What was that experience like going through the surgery? Do you recall much?
Absolutely. It was the scariest moment of my life. You know, as they wheeled me into the emergency room, I held hands with my wife, and I shook hands with a couple of my friends that were there waiting on me as the ambulance pulled in, and I thought, this is it. This is how I'm going to die, right here today in the next few minutes. And they took great care of me. They explained to me what was going on and what they were going to have to do. And there were 9 holes put in my body that day. A large opening in the middle of my chest, and then 8 other places where they have to cut into you to make you better. They took a vessel, I guess it's a vessel, blood vessel, out of my leg and put it in my heart, and made me a bionic creature of sorts. It's been a traumatic thing, but it's also, not only was it the worst thing that ever happened to me, it's become the best thing that ever happened to me. My brother had these same symptoms in the same surgery 10 years earlier. Now I'm desperately trying to get him to quit smoking and to eat better, but our father died at age 51 from this disease, and had a heart attack and was gone, and I miss him every day. And I want folks that are suffering or think they may be suffering from these kinds of problems, get yourself checked, get your heart disease problem fixed. It can be fixed.
Well, some of the best advocates for heart disease prevention and screening are people that have gone through that. And so that's why I wanted Jim to come on our show today and share his experience with us. And today you feel great.
I feel so much better, so much better. We went to the zoo not too long ago with my youngest son and my oldest son and our grandchild, and they all got tired before I did. And I thought, this is amazing. It's an amazing transition that I've been able to make. Thanks to you, Dr. Gooch, and all the great folks at Baptist. It's just been one of the biggest blessings any man could ever have, and I thank you so much.
Well, Jim, it's a pleasure taking care of people like you, and I know you're so grateful. And again, the emphasis is, just as Jim said, early intervention. Don't be macho man and try to ignore symptoms. If you have problems, oftentimes, as Jim said, you can get to it early where you don't have to have bypass. Don't let the idea that everyone's going to have bypass surgery, because they're not. But if you get to your doctor early enough, things can be done to prevent that. And our next patient that we're going to talk about that, something that you can do for heart disease other than a bypass. This is Dr. Mark Costello with Health Matters. Thank you for joining us on Health Matters. I'm Dr. Mark Costello. Our program today is about heart disease, And we just had a patient on that discussed about having a bypass. Well, there are other procedures that can be done by heart doctors and cardiologists that can restore blood flow to your heart and prevent you from having a heart attack. My next guest went through one of these procedures, Mr. James Irwin. Jim, nice to have you.
Thank you, sir. Good to be with you.
All right, Jim, tell me about the symptoms you were having the day that you came into the office.
Well, I've always, for most of my life, adult life, I've been active running or walking. I used to run 7 miles a day, and until recently I had to walk, and I got up to 4 miles a day in about an hour. I did that regularly, 4 or 5 days a week. Then one day, without any notice, I started to run, and within 5 minutes I had to stop. I was having some discomfort in my left arm. I was having a pain in, well, not a pain, but just some discomfort in my chest, and seemed like that I was just trying to burp all the time. And so I went back to the car and went home. Tried walking the next day. Same thing happened.
So did you think something might be wrong with those symptoms?
Well, I did. I knew something was. And like you say, most men, have a stubborn streak in them.
Right.
But on the third time that it happened, I told Rose, my wife, what was going on, and then she said, "You need to go see Dr. Costello." So after about another week of that,
So wait a minute, now, your wife told you to go, but then another week passed. Okay, I want to get that straight.
So I did come to see you, as you know, and after just a few minutes in your office there, you knew what was wrong, as I told you the symptoms, and then you scheduled a doctor to do a heart cath. That was done at Baptist East. He found that I had one of my arteries was 99% blockage, and he put a stent in. That was about 3 weeks ago, just a week before Christmas, really, and I'm doing fine now, feel well.
Oh, great.
He's allowed me to start back my walking on a treadmill, which I started this Monday, just not quite as active as it once was, but
You're going to get there.
I have no more
Symptoms
pain
at
or
all.
angina or symptoms in any way.
Well, if you can look on the screen, you can see a picture of Mr. Irwin's coronary arteries. This is a picture from his heart cath, and you can see midway one of the arteries is not receiving proper blood flow. And in the second picture, you can see that same area now is wide open because the stent had been placed and the blood flow restored to that artery. Again, Mr. Irwin is a great example of having single vessel coronary disease that you don't have to have a bypass for. Now, when you went in and had the heart cath, you had the stent put in, how long were you in the hospital?
Well, I stayed overnight and went home, the next morning.
And then pretty much resumed normal activity after that.
Within the next day. I was restricted for lifting anything for a few days, but other than that, no problems whatsoever.
Well, again, we keep driving this home again and again, how important it is to get in and see your doctor when you start having any kind of atypical symptoms, and they may not be coronary disease. There could be a lot of other things, but like in Mr. Irwin's case, that 99% blockage was about to be 100% blockage, and he would have had a heart attack. And because of his wife, God bless her soul, getting him into the doctor, he was able to get this taken care of, and now his heart is as good as new. But thank you so much for being with us, and what do you need to tell our audience about their symptoms?
Well, thank you, Dr. Costello. I think that it's so vital to, I've heard all my life, you need to listen to what your body is saying, and I failed to do that. And I do not know more than my doctor, and And I would just encourage anybody that has any kind of symptoms like that, check it out. If it's nothing, okay. But in my case, I was an accident about to happen, seriously, according to what the doctor told me.
Well, thank you. This is Dr. Mark Costello with Health Matters. Thank you for joining us and staying with us on Health Matters. I'm Dr. Mark Costello. Our program today is about the heart, and we're having specialists, we're having patients on the show today to tell us about their experiences with coronary disease. Do you know that people that have heart disease, 1 out of every 4 can die of a heart attack? And also another startling statistic is every 25 to 30 seconds, someone in the United States is having a heart attack. So it is so important for us to understand the signs and symptoms of coronary disease. Well, my guest now is Dr. Jerry Gooch. Dr. Jerry Gooch is a cardiothoracic surgeon with Baptist Medical Group. Thank you for joining us, Jerry.
You're welcome.
Now, Jerry has incredible experience. He's one of the foremost surgeons in the Mid-South, and we're so fortunate to have him today. And actually, if you've been watching this entire segment, the patient that we had earlier today, Mr. Jim Sykes, Dr. Gooch was the one that operated on him and repaired his blockages. Now, Dr. Gooch, we talk about bypass surgery. What does that mean? What is bypass surgery?
Well, bypass surgery is really literally just taking a vein or an artery from the patient and going around, bypassing around the blocked artery. Where a stent would be taking a balloon and opening up the small area and using a little coiled metal to keep that open. Bypass is, if you can imagine, something like biological plumbing, where we took a vein and just went around the block from an area where the artery was normal to another area where the artery is normal and go around the blocked artery.
Now, what determines when someone needs a bypass or someone needs a stent?
That's really determining the anatomy of the heart. Some arteries are better to stent in the anatomy of the plaque or the blockage. If it's a short blockage, it's fairly easy to balloon and stent, and if it's a long area of narrowing, it's much more difficult. Most patients, if they have 1 block or at the most 2 blockages, might be a candidate for a stent. If any more than 2, certainly most people would be candidates for bypass surgery.
Now, what are some of the statistics about the survival rate of bypass surgery compared? Now, bypass surgery first started when? In the early what?
It was like the mid-60s, 64, 65. Actually, Dr. Garrett, one of our pioneers in Memphis, performed the first bypass when he was in Houston with Dr. DeBakey. And it just accelerated through the 70s and 80s, and still very similar to the same procedure done today, with the addition of some minor technical changes.
What are some of the statistics now that with people that undergo coronary artery bypass?
Well, today the risk is around 1%, both actually for a stent or bypass. And that's a 1% chance that anything really bad would happen. You die, have a stroke, have an infection, any major complication is relatively low.
So there's been major progress in coronary artery surgery.
Absolutely, and it's done very commonly with a very low risk and a very rapid recovery in most patients.
Now, walk us through, Jerry, a little bit about a bypass. If we've had a heart cath and the cardiologist has consulted you and you've come in to see the patient and it looks like they're going to have surgery, what's the procedure? That's a scary thing for someone to look you in the eye and say, you're going to have a bypass. So tell us what happens.
Well, during the surgery, we take a vein from the leg, and most of the time now we can take that with a scope, like gallbladders are done through a scope, and that's one of the major advances in technique today that can be done endoscopically, we call it, on a TV camera, and take with just a small incision on the leg, we can take out the vein from the entire leg. And that's like a small tube from a superficial vein in the leg that's sort of an accessory vein, and use that as the conduit or the piping, if you will, to do the bypass. And so it will open the chest and then place the patient on cardiopulmonary bypass just so we can do the procedure, and then just take each artery one at a time and go above and below the blockage, whether it's 3 bypasses or 4 bypasses, and then resume flow to the heart. So it's really something similar to plumbing, but it's just biological plumbing.
So you're a plumber?
Yeah, biological plumber.
Well, most plumbers get paid probably better than you. But anyway, does it matter how many bypasses that you have? Some people say, well, I had a double bypass, I had a triple bypass. What does that mean?
That means the double would be obviously 2 bypasses, the triple 3. Actually, statistics are the same. You know, the mortality and complications are the same whether it's 1 bypass or 4. So it's not more serious to have 4 than it is 1, because that 1 might be very, very important.
Now, after surgery, of course, you go to ICU. Then what happens? What's the recuperative time for bypass surgery?
Most patients are taken to the intensive care unit straight from the operating room and on the ventilator for 3 to 4 hours, and then weaned off the ventilator. And generally, the next morning, they're up in a chair, you know, taking liquids. It actually moves very quickly.
And during the bypass recovery time, is there any type of rehabilitation or cardiac rehab that patients undergo?
They do. They see physical therapy and cardiac rehab nurses actually the day or 2 after their bypass, and start exercising. And usually by the time they go home, they're ambulating in the hall, probably taking a shower, dressing themselves, you know, recovery fairly quickly.
The average amount of time before that someone has a bypass and they can return to, say, a office job is about how long?
I would say probably 4 weeks. You know, somebody has heavy manual work, maybe 6 to 8 weeks. Most patients could resume some kind of light driving in 2 weeks, you know, just if they were careful. So it's fairly rapid recovery.
Do many people have to ever have a second bypass surgery, or is usually nowadays one does the trick?
The operation is really not curative. It's not like taking your appendix out and you never have obviously never have an appendix. This is really a procedure just like maybe cleaning your sink out, the sewer or your sink pipe. It could block up again, but I think today's medical treatments with statin drugs for cholesterol, aspirin, certain medications, beta blockers, and of course exercise, you know, the progression of the atherosclerosis is much slower than it once was. And so we do redo operations, but many of those patients are patients that continue to smoke or resume smoking, and those patients are more likely to have a second operation.
So it's very important, even though you get a bypass, it's still important for you to continue to watch your cholesterol, your weight, and exercise so you don't have progression of your disease. Right. Well, thank you, Dr. Gooch.
You're welcome.
Today on Health Matters, we learned a lot about coronary heart disease. And again, I want to emphasize one more time, I know you're tired of hearing it, but I want you one more time to tell you, please get a checkup. You can go to Baptist Medical Group, Stern Cardiovascular, but get your heart checked and make sure you're okay. Next month, we're going to talk about cancer. Cancer touches just about everyone, and we're going to have specialists and patients to talk to. I want to thank Mr. Jim Boswell, Claire Hicks, Herbie O'Mell, and the staff here at Channel 18 for making this show possible. I'm Dr. Mark Costello, and as we always tell you, your health matters.
More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Get better.